There's two types of cosmetic dentistry. One is putting back what you once had, and the other is giving you something you've never had. Putting back something you once had could be a broken tooth, it could be a chip, it could be just worn or aging, and that's something that's relatively easy to do. Giving you something you never had is for a patient that just was born with teeth that aren't very attractive. They're dark, they're chipped, they're irregular, they're not very pretty. And for that, bonding procedures, bleaching procedures, and veneers and things like that can make any smile look as nice as you want it to look.
Dr. Albers uses a lot of technology here, particularly the CAD/CAM system, and I can enhance what the product gives. And ultimately with aesthetic dentistry, that's what you're trying to do. You're trying to camouflage. You don't want it to be obvious. The most natural looking restoration. Almost any natural looking restoration has got porcelain applied to it. And so my 15 years of experience that I've had working with porcelain, I'm able to understand the difference between opacities and translucencies, and through that process I'm able to mimic natural teeth. It's a custom work.
Dentistry is probably the most cost-effective method for improving the way you look. Plastic surgery is very expensive, it's invasive, it takes a long time to recover from. Dentistry, on the other hand, is relatively simple, it's short treatment periods, relatively inexpensive, and very cost-effective. Dental procedures, once they're done, they last a very long time relative to other types of procedures you can do to improve the way you look.
When I've made something for somebody that makes a significant change in their life, when I exceed their expectation, that means a lot to me. I've had one woman tell me that she hasn't smiled like that since she was a teenager. Making that big of a difference in people's lives, I think, is the most rewarding part about this job. But being able to trick the eye and that I actually did it is even, for me, more satisfying. It's very scientific, but my part of it is very artistic.